Hey everyone, this is Reggie from Restore Plus Physical Therapy, and welcome to today's tip of the day. With the spring and summer season, a lot of people uh, take to the outside and start doing exercises outside. So running has been a very popular exercise, especially during the pandemic where everything was closed. I know a lot of people, and including my patients, have started doing running as part of the exercise, and a lot of them have continued. Now, with that being said, there are some conditions or some aches and pains that came about with people who actually got into running, especially if they're not in shape or they didn't, the body wasn't warm up enough, wasn't ready, or they got injured, things like that. All right. So the injuries can or the cause of the pain can range from having just irritation, strain, some tears, or just wear and tear, especially as if the person is a little older and they start taking up running. All right. Now, that is a very common condition that we see in the clinic. What are we're able to do is our goal is to be able to get them back to running because that's what they want to do, and that's what we're here for. Be able to get people back to what they love doing. Now, the thing is, okay, with the exercises, modalities, treatment, a very common question that I get asked is as they get better, the question is when do they start going back to running? When is actually a good time? All right. And I want to share my answer to that. And this is what I tell my patients. Well, first, definitely we have to control that pain. If you're still in pain, I don't want you to be running. Definitely not the full speed running or the distance that you were running before. All right. So we have to get that pain under control. Just make sure that we correct the imbalances, right? We have the strengthening and stretching program. You're doing those already. So that way you'll minimize the chance of getting worse again when you start running. Now, when your pain is under control, then we can have I allow the patient to start progressively going to running. The sequence can be from walking, regular walking, brisk walking, to slow jogging, and then to like running, slow running, and full speed running. So you progress gradually in terms of the speed and of course the distance also. So you want to have the pain under control, correct the imbalances. You're doing your stretching and strengthening exercises, then you progress to the running. Now, before I let my patients go full speed running, I tell them this: there's one activity that they have to be able to do for me to actually feel comfortable and get them to say to them is, okay, you know what, John, you'll be able to go full speed running. And that is, they have to be able to hop on one leg multiple directions. All right, so that is part of our rehab program for patients who want to be able to run again. So we start with either hopping with both feet, can be hop in place. You start jumping jacks, get some movement there, and then jump rope. Those are good, and that's a good progression. And then you do one leg hops, can be one leg hop in place, and then you go forward, back, side to side. You can have either just have a line on the floor, or you can have a strap that you can use as give you visual feedback, right? Or then you can add the progression to that is then you can do the star hops. So you're going to be hopping forward with, this is only one leg, you're hopping forward and then hopping to the side. So you're making kind of an asterisk direction there. Okay, so you go forward, diagonal, side, diagonal, back, diagonal, side, diagonal, forward. And usually when they do it in the clinic, we have those strips on the floor, so they have visual feedback on where they have to land. At home, you can just draw. If you don't have that, you can even just draw them on the floor. If you're able to, put tapes there, so you have markers, right? When they're able to do that comfortably without pain, then I would say that's the best time for them to actually be able to go back to full speed running. All right, so that is my suggestion, that is my answer to my patients, and that is my answer to everyone who asks me when can I actually go back running. So there's a few, I know it's not just one answer, there's a few things that we discussed there. It's a progression leading up to that end goal. which is be able to run full speed, because we want to do it that way to minimize the chance that you're going to get re-injured and then you're gonna go back again, and you're gonna lose everything that you've gained. All right, so what do you think? I mean, I would love to know what you think about this. What do you think about the progression? Is that something that's reasonable for you? Or do you think that's too slow? Or do you think that's not doable or that's doable? I would love to know what you think. I always love to get your feedback. So that way, if there's any questions, I'll be able to help. And if, let's say, you're getting better and not able to get to that last stage where you can actually be able to run, which sometimes we have patients like that, they just need that little extra guidance at the end to get to, you know, that like final level of being able to run. Definitely reach out to us. You can reach us through email, through phone, or you can DM us directly, so that we'll be able to reach out. You can reach out to us or be able to reach out to you so that we can help you get back to doing what you love to do. All right, but definitely let me know, you know, what you think. And if you know anybody who will benefit from this, they're having those pains or they're into running, there's something good for them to know, please share this with them, because this will be very helpful for them. All right, so thank you very much for your time, for watching this video. I appreciate it. Remember, I need you to like, comment, subscribe, and share this video so that you can help transform other people's lives. And let me know what you want me to discuss or talk about in the next video so that I can help you stay healthy and pain-free. See you in the next video.